Hey everyone, welcome back to the Biotech Project. We're happy to be here again with another weekly episode with you. Today, we thought we'd change gears a little bit, do things a little bit differently. Scott and I thought we would just connect him and I and give you a little bit of our thoughts about where we are with the Biotech Project, where we're hoping to go. And I thought it'd be kind of cool if we took a little bit of time to share a little bit about ourselves and get to know the host. So spend a few minutes asking Scott about his background so you get to know him a little bit. And again, always excited to be here. Feel free to look us up on thebiotechproject.com. Any of your favorite social medias, just search the Biotech Project and you'll find us. So without any further ado,
you want to break into and navigate your career in the pharma and biotech industry. We know how to teach you. This is the Biotech Project. From sales to medical affairs and everything in between, we're talking about it. No matter how you got here, from here to your next role is up to you, and we're here to help. You'll hear from guests in every role, from CEO to sales, recruiters to hiring managers. The Biotech Project. Here are your hosts, Scott Resnik and Dr. John Walsh.
All right. What's up, John?
Scott, how are you?
I'm doing well. Excited to be here. Can't believe we're up to recording our 6th episode at this point.
Yeah, it's been a great start, man. It's been a lot of fun. I hope everybody else out there agrees. I've been getting a lot of really great feedback from people by text, by LinkedIn, email, the whole bit. So for me, it's been a blast, man. It's been really good so far.
Yeah, I agree. I mean, it's always fun to look at the comments and whatnot, and I always get a kick out of seeing the kind of milestones with the listens and the downloads. I mean, having an episode when it hits 100 downloads is it feels pretty cool. Considering we're just getting into it. So for me, it's really all about giving value for people that are taking the time to listen for 45 minutes or so of their day, and we've had some really great comments. And what I also think is really cool is how many people are reaching out saying, "Hey, what you guys are doing is great, and I'd like to be a part of it." So I think that's the other thing that's really cool.
Yeah, without a doubt. I've had a bunch of former colleagues, and as you know, we've even had some folks that we've just had approach us from the Twitterverse or from the internet, really interested in coming on in the future. So we're super excited about bringing people on and really sharing everybody's experience, because that's what this is all about, right? It's about people finding out about different parts of biotech. So I think it's great, man. It's been a lot of fun.
Yeah, and the best part is, we're kind of exploring things that goes across the whole spectrum. We're not just sticking with one particular topic. For me, it was great hearing from Danny and learning a little bit about the medical side of things, because as close as you and I have been for so many years, I don't think I've ever really sat there and kind of picked your brain the way I did Danny's. So it was that was fun. And of course, our last episode with Greg was incredible. Real value that we're starting to bring. I mean, everybody that's been on the podcast has really added such value. So I'm looking forward to the next guest and what they're going to bring and what I'm going to learn. So it's been
True.
great.
I mean, I've learned a lot from all of our guests. I mean, some of the tips Andrea gave us as well, super helpful. I think everybody approaches this whole thing from their own perspective, and everybody has a unique journey, so they bring different things. And I said it on the podcast, and I didn't say it just because, for the hell of it, but I learned a bunch of things from each one of them. And I hope that there are little tools that we can throw in our toolbox as we go through our careers that we can use moving forward. And I'm sure that's going to happen with future guests. I know I had the great opportunity to talk to somebody from the recruiting world today, who's interested actually in joining us. So we're hoping to chat with some recruiters as well too, because I think it's important for people to learn about what's exciting in the recruiting world, what makes a really good candidate, what type of skills you can have to be ready for the right job when it comes along. Like we've always been saying, whether you're brand new or whether you're switching into a new role or changing companies or working within your own company. So to hear about what's important to them and kind of peel back the curtain a little bit about what makes a great candidate. We heard a little bit from Greg, but it'd be really cool to hear from someone who's not directly in the industry but interfaces with the industry. So I think there's so many cool possibilities for the biotech project in terms of where we can get all these learnings from.
Yeah, I mean, I try and think of a tidbit that I learned from each episode. Going back to our first one with Justin, hearing the way sales ops has to think about, beyond just the sales numbers, but the organization and what the footprint looks like and how those things are decided was great. Andrea kind of just bringing to light this whole concept of the great resignation. And, you know, I don't think I thought of that is part of our industry until we got into that conversation. And I started looking at, people I know that were at a company for just a few short months before they said, nope, not for me, and moved on to the next one. Um, and then with Greg, hearing him say, you need to think of the first interview as the last interview so that you ace all of them, not just, the one. I thought that was, really, really interesting too. So um, it's
Yeah,
just
so true.
been great.
And
Yeah.
I think the other thing that's been really cool for me has been the diversity of backgrounds of people, right? I mean, we're only into this a few episodes, right? 6 episodes now, and we've spoken to people who do a whole bunch of different things in the industry. And for me, just having come from the medical side, hearing Justin talk about sales operations, not something that I deal with directly day in and day out. Hear about it. I've sat in the planning rooms in the boardroom hearing about what sales ops does, but it's important really to see what really happens, how that goes into play. And there are analogous roles on the medical side, so it'll be really cool in the future if we bring somebody in as an example from medical operations. We'll be able to say, hey, how does that differ on the sales side versus the medical side? And there's so many different functions that we haven't even started to bring onto the podcast, whether it's legal or regulatory or manufacturing or quality. um, the list goes on. There's so many people I know. We have a CEO or two that are also interested in coming on the podcast. So getting that really macro view, right? What's it feel like to run a company? What do you
Yep.
think about? And then when you want to build the team and you want to fill your bus with the right people, how do you go about doing it, right? How do you build that right culture?
Exactly. And, bringing on sales leadership and commercial leadership, I think is going to be great to, again, to look at the next layer of the onion and understand things. I have questions. Why are certain things done that I can't wait to hear answered by future guests? Um, and, the cool thing is this isn't a pipe dream, right? We have these people lined up to come onto the show. It's really cool. Like I didn't think we were going to get this type of response. I thought we might have to be mining a little bit for some guests, and we just haven't had to do that. So it's really exciting.
Yeah, it's been awesome. And just again, a shout out, like we've said in prior podcasts to the folks who are listening. If that's you, if you're the person who would like to share with us your story or you have a unique background, and feel free to reach out to us and let us know. One of the things I found really interesting is everybody feels like, oh, well, what do I have to offer? I've had people say when we've been chatting about it, well, what am I going to say? What's the big deal? But it really is a big deal. Your background is different than every other person's background. How you got here, how you've progressed through your career, what you want to do moving forward, and that's important to people. And hearing different things and different ways people get through this industry is kind of what we're about. So if
Yep.
you're out there saying, I don't know if I'd want to do that. chances are there's somebody that wants to hear how you got where you are. So don't be shy, reach out. We have a link on our webpage at thebiotechproject.com. And if you check in the links there, you'll find one that says register as a guest. So feel free, put your information in there, let us know. We'll reach out to you. We'd be happy to have a discussion beforehand. That way, you can find out what it's all about. And we'd love to have more people join, because that's how this gets better, is hearing more about a whole bunch of different people.
Absolutely. And, to kind of take it to the next level, we are definitely going to start to, look for some support, some sponsors of the website and the podcast. So, hopefully we get some maybe recruiting firms that are looking to do a build out and they want to come on and talk about that and help us to find good candidates for them. That'd be a great example of somebody, that could be a perfect sponsor for an episode of the podcast. So, feel free to reach out to us too with questions about how you may be able to help us do that.
Yeah, absolutely. And if you're working in a company and you have roles that you're looking to fill, that's another opportunity, right? We'd be happy to have you on, and you could talk about the unique situation that you have at your company or your firm, and you could tell us all about what you're looking to do to expand. Our hope is to have a group of listeners who are interested in career progression. What a better place than to be able to speak directly to people who are interested. Of course, in show notes, we can leave links in there so we can direct them right back to you. So if anybody sees it as an opportunity for them, it helps our listeners, right? Because the purpose of this is to get our listeners connected with opportunities. So everybody wins there. So feel free, again, reach out to us. Don't be shy. We really like to hear from you. But today, what I wanted to do too, Scott, is we chatted about this before we began. Is I think it's really important for people to understand who they're talking to. So, in the next few minutes, what I'd like to do is maybe just spend a few minutes talking about you and make you kind of our guest for the day.
All
And I'd
right.
love to learn about your background. So maybe if you could give us a little bit of a guided tour about who you are, how you got into pharma, how you've progressed your career through biotech, things like that. And feel free to take the mic.
Yeah, absolutely. I'd love to share. So, my, I guess my project, my personal project here, goes back to when I was in college. I, got into emergency pre-hospital medicine as a medic. That's where John and I actually met. And I loved it. I fell in love with riding the ambulance and eventually taking on leadership roles in the EMS world. Um, but what I also saw is a lot of good friends of mine that were career professional, emergency services people that were honestly, let's kind of say it like it is. They work in 100-hour weeks to be able to afford to have a car and an apartment and whatnot, because emergency services is not very lucrative and is it's problematic. So I knew I wanted to somehow be involved in medicine, but I also fell in love with the business world. So in college I had a triple major where I majored in communications, business, and psychology, and wanted to find a way to maybe meld those two worlds. And while I was at my volunteer ambulance company, the gentleman that was chief there at the time was actually a pharma rep. He was a drug rep, and I was fresh out of college. I was working for an insurance company doing sales, and he was. I saw him dressing up every day in a suit, meeting with doctors, taking them out for dinner. And I said, "Hey, tell me about this. This is really kind of interesting to me." And he talked to me a little bit about what it was like working in pharma. But at the time when I, had graduated college back in the mid 90s, you had to have real solid sales experience to be able to get into the industry. You couldn't just, kind of walk in out of college. And so I went and I got some additional sales experience, hard nosed sales experience. I sold like printing and binding and stuff like that. Uh, didn't quite have to sell a copier, but I was selling, stuff that was kind of old school. Um, Paid my dues for a couple of years, and then at that point started trying to really break into pharma. And I went on a couple of pharma interviews, and I was put in a position where I had two choices to make, and I chose one. I started out as a urology specialty rep in downtown Brooklyn, calling on urologists, talking about things like erectile dysfunction and overactive bladder and antibiotics. And it was this really cool world. And interestingly, I was getting ready to get married, so had a very large wedding bill coming up, and said, I'm going to go all in and try and really make a name for myself. So built tremendous relationships and became really, really successful. And I had a few companies that were interested in bringing me over into different roles, and I had an opportunity to move into hospital sales. I was, looked at for a couple of specialty roles, hybrid roles, kind of all these cool roles. And um, I bounced around for a little bit there because I thought I was going to go to one company. Ended up meeting a manager by chance from another company that was, somebody that I just really connected with. So went over to that company for a little while. They were acquired by another big company that didn't feel right for me. So I made a jump to another company over into the hospital world. Um, and while I was in the hospital world, I was approached by one of my clinical investigators for another company, who said to me, "Look, you're in this really big organization. You'll never be able to, really differentiate yourself and kind of stand out in such a huge organization. You should consider getting into a smaller startup company." And, you know, um, this was right around the time of 9/11. And of course, both of us spent a good deal of time at 9/11 because we are
Hmm.
both still involved in emergency services.
Hmm.
And, that was a real wake up call, and, that how things could change. And um, looking at taking chances in life, and very similar to what some people are doing now with the great resignation, right? I decided to meet with the company that she was involved with, and I went over to them. They were a startup putting their first field force together. That was incredible. I got to get my hands into marketing. It was interesting. I pitched an idea of presenting our product to emergency medicine and emergency services. And, half the company thought I was crazy, but we had a great marketing leader who said, "Well, we don't have the resources to put into it, but if you want to put the time and energy in, we'll support you." And, I was going through clinical trials, looking for people that were doing studies in the respiratory space, and just picking up the phone and calling people. And you know picked up the phone and called a gentleman that was out in Seattle, and he said, "Hey, this is interesting. Why don't you fly out to ASAP and meet with me and tell me more?" And that was kind of the start to building out this whole franchise that ended up becoming really a strategic business unit for this organization in
Yeah, I remember him
emergency.
well. That was a really great time too, because
Yeah.
as you know, we did some work together at that same time, and
Yep.
just knowing him and his background and so many of the things he did, it was just fascinating guy,
Yeah.
right?
Yeah, and the big thing was, having an organization that kind of supported this, right? So that was my first experience with the startup mentality was, hey, we might not know about it, but if you do, and you're willing to kind of put the work and effort in, let's see what we can do. Let's roll with it. And that was, my first experience there. And I was there for a number of years. Um, my wife had just had our first baby, and so I wanted to be home. I didn't want to go into management or anything. So I stayed in, that frontline role, went into different ones, back into institutionals and whatnot. And honestly, I hit a point in my career at that particular organization where I had done everything I could remotely, and it was either time to go inside. So, there was a big pull to bring me into marketing, which was in Boston. So it would have meant relocating. The fun part was the recruiting process when they were trying to bring me in, when they would, take me to a Red Sox game or out for dinner or to some fun places in Boston while we were talking about things. But ultimately, we decided to stay local and and whatnot, and I was recruited by another company, by a previous manager I'd worked for, to help start a new division in a larger company. And it was kind of going back to those original days at at an organization again. That was fun. It was difficult because the product had challenges, and while I did well, the overall organization didn't do well. But my advice with people is, wherever you are, you have one thing that you can control, and that's your reputation. And one of the things I've always tried to do is make sure that my reputation was, as stellar as I could have it. So putting myself out there, taking on responsibilities, taking on things that, maybe you get visibility without the financial reward, because ultimately that's, who you are. And while I was watching this, company start to kind of dismantle itself, I was recruited by somebody who became the chief commercial officer at another startup, who had worked with me at that original startup that I went at and knew my reputation. So, you know, reached out and told me about this new organization they were trying to start, and ended up over there. So there's this constant in my career, which was making solid relationships and connections within whatever organization I was in, with different areas of the business. So you're talking, one person was a sales manager in a completely different division that I didn't even really work with, but we created a relationship. They knew my persona and what I brought to the table, and whatnot. Another one was, a marketing director who eventually became, chief commercial officer, and knew what I did in the field. So I think that's really important, kind
Yeah,
of
and I think
consistent messaging.
one of the thing you raise a really great point is the ability to keep your own identity, keep your own reputation, but also the ability to network, right?
Yep.
When it comes to jobs, as an example, right? Most people connect with their next job from a former colleague or someone who knew of their work, um, or also through recruiters. But having a good reputation is what brings your name to the right recruiters too.
Yep.
How many times are you in a role and you get a call from somebody and you say, "Hey, man, I have a really great role. I'm not looking, but I know two or three other people who are," and that's when your name comes up. So
Yep.
keeping a really good reputation, but also keeping networked is really, really, really important. And honestly, I think it's fun. I love to stay in contact with my present, but also my prior colleagues.
Of
And
course. Yeah.
it's a great way to cross pollinate ideas for what you're currently doing. It's a great way just to understand what's happening in the industry outside of your immediate therapeutic area. There's so many benefits. So I can't say enough about networking. So it's obvious that you benefited from it as well.
Yeah, and my career has just kind of been that cycle, of opportunity. So, I've been at, a number of startups at this point in my career. I've been at a number of companies that have been taken over by other companies. Sometimes it's worked out, sometimes it hasn't. But you learn to roll with the punches, and to just continue to do what you can do and control what you can control. I think that's, the single most important thing that I can tell everybody.
No, it's so true. And it's funny. I had someone in the past when I was looking for career advice, a colleague that I was working with, and the situation that I was in wasn't wonderful, right? Everybody was struggling a bit, and he gave some really sage advice. We sat down for lunch one day, and he asked me, "So how are things?" and this and that. I said, "Oh, they're okay." And he said, "Well, let me tell you one thing." He said, "The one thing I've learned is that." Um, you can learn so much from a really good situation working with people who are great in a situation that's winning, and it's awesome. But you can also learn equally as much when things are tough, right? You
Oh
learn
yeah.
maybe what not to do. Maybe you learn what mistakes were made so that you don't repeat them, or you learn how to manage a difficult relationship, which is just as important of a skill as it is
Yep.
to manage the relationships that are a pleasure. So every situation that I've been in, like it or not, easy or hard, I've managed to try to learn something from it.
Yeah, and I think the important thing is to take in the good and the bad. You're going to work for great leaders. You're going to work for leaders that maybe you don't think are so great, right? But the best advice I ever got was from a manager at one of my early companies. This guy was unbelievable. Shout out to Ken Mayer if he happens to still be around. Um, he said to me once, I got very frustrated with something, and I was spending a lot of energy looking at the negative side of it, and really focused on it, and couldn't see past it. And he sat me down and he said, Scott, we are born with only so much energy to expel. And if you go back to, I guess it's physics, right? So energy can neither be created nor destroyed. So you've got a limited amount of it. And it's very common for people to spend that energy on trying to express frustration in something that's just never going to change, right? It's just never going to change. But if you take that same energy and you say, well, what can I focus on where I can affect change? That will make life happier. You'll do better at work and you'll just feel better about yourself. And I think that's some of the best advice that, I ever got. And I think that, while it's not always easy, and certainly we sometimes, lose track, if you can come back to that, it really makes a lot of sense. So, that's certainly big advice out there,
Yeah, it's true.
that I can
Perspective
offer.
is everything, right? You at the end of the day, like it or not, and sometimes we've done it well, and sometimes I've not done it as well. But you get the opportunity to react and to respond in the way that you choose,
Yeah.
and it's all about that energy. So, like I said, it's always a skill that people can improve. Myself very much included. So you get to kind of create a little bit of that energy too.
Yeah. And, I mean, from there, I've just kind of followed myself. I've spent a lot of years in the oncology specialty space, dealing with, some rare cancers, some wildly, rampant cancers. And for me, that's been really, really personally gratifying because just about 8 years ago, I was diagnosed with cancer myself. So, having been on the other side of waiting for the results of a scan, and the stress that goes with that, and having definitive treatment, and now 8 years out, where you have a different perspective. I remind myself every day, and I was able to give a town hall, um, guess a keynote speak at a town hall at an organization that was getting ready to launch in the kidney cancer space, and that's the cancer I happen to have had. Trying to talk to the organization about how important what we were about to do was, and the thing that I kept talking about is I don't care what role you have out there and what specialty. I don't care if it's foot fungus spray. You've got a role out there, right? And if you work for the company that's promoting foot fungus spray, no matter who you are, from the security watchman that lets people in the door all the way up to the CEO, everything that you do at that organization affects a patient, right? And in some way or another, you're going to affect the patient. It may be indirect, it may be direct, but if you can, if we can get our industry to focus on that there's a patient on the every other side of every single conversation that takes place, I think we'll all have great success as an industry and great success as individuals. So, I've been blessed, ups, downs, parallel moves, whatever it may be. I consider myself to be blessed because I get to help patients every single day. So going back to what I originally shared, how I love emergency medicine, and love being in the back of an ambulance, and, helping people every day. For me, I just had, this view of what I wanted out of life, and being able to spend time with family and coach and do all these other things, which led me down the path I went. At the end of the day, I'm still helping patients every day, and that's where I was able to marry those two things. So
Yeah. And it was funny when I first started in the industry, as a physician, you're directly helping patients, right? You're in the office, you see someone, you hopefully address their problem, whatever that might be, and help move on. And when I first entered industry, it was a little bit of a struggle, I'll be honest, because you're doing things where you don't directly see the face of the patient right in front of you.
yep.
But I had a colleague tell me at the time, he said, "Well, the reason I joined industry is because I have the opportunity to help a whole bunch of people." And it didn't feel real for me in the beginning. But as time went on, and I worked on numbers of different drugs where you see them get approved and you see them go on to affect people's lives, and you see the actual result, it's really cool. It's really
Yep.
cool to say, "Hey, I was part of, I was a cog on this big wheel that really helped push this forward to the point where a drug could become approved and it could become available to patients. And now it can affect thousands to millions of lives over the history of that drug." So, as much as pharma gets trashed on a lot for a whole lot of different reasons, I really I believe that all of us have to come back to the reason why we do what we do, and it's about what you said before. It's about patience,
Yep.
and we help tons of people. And it's hard every day. You're making the next slide presentation, or you're on that next meeting, or the Zoom call of the day, and it's hard to remember sometimes. But literally everything we do ultimately boils down to pushing the science forward and getting medicines out to people.
Yep.
So it's actually really, really cool. And I find it fascinating, and something that's really, really noble, despite what the world would have to say in the
Yeah.
mainstream about pharma.
Listen, I've had a lot of great things happen in my career, won tons of awards, everything. But the things that really stand out, I could think of this like it was yesterday. A number of years ago, I had a drug for bladder cancer, and really there weren't a lot of people using it. And it was frustrating because the data was really good, but it just went against kind of some of the, common things that were going on. And, there was a physician who gave me the time to present, talk about, a patient profile that really fit. And, this is corny because this is what we do, right? But he gave it a chance in a patient. And, had we not had that meeting, wouldn't have had that chance to give it to that patient in all seriousness, because it just wasn't what was thought of off the top of the tongue. And 3 months later, had a conversation with them about how that patient was doing. And this was a patient that, was older, had grandkids, had kids, was just looking to get a little more life to be able to share and create memories, right? And the the emotion is hard to deal with because he pulled me aside and he said, this was a patient that we really kind of just threw this at them because we just didn't have anything else. And here we are 3 months later, and this patient happened to be in one of those rare ones that had almost a complete response. And although it's likely to be short, you know, that this type of response is seen, this patient was given an opportunity to spend more time with their family. And when I personally got sick, I had a conversation with I have a great medical oncologist, and I had a conversation with him about the reality of my situation. I had stage 3 cancer. I was considered, intermediate to high risk for recurrence. And, kidney cancer is a really just a cancer that doesn't think like other cancers. It can come back at any time. It just, it works different. And the conversation he had with me was, look, I can't guarantee anything. I can show you nanograms and nomograms, and I could show you statistics and, everything we want. But here's the reality. Your statistic is either 0 or 100. Either you've got 0 recurrence or 100% of recurrence, right? That's the reality. But what you can do with that time is take the time and create memories with your family, because if something happens to you, those memories are what lives on. And that really resonated, and I think about that every day in what we do. And sure, not everything that everybody does that's going to be listening to this podcast has something to do with life saving or life you know increasing life expectancy, or anything like that. I mean, we've talked about things from ophthalmology as an example. Well, maybe there, the buy-in, that personal gratification that you get, is somebody that might not have been able to see their granddaughter wearing their wedding dress can see it based on that. So I think it's important for everybody to think about that and really see what their drivers are and dedicate themselves that way. And I think that's important.
It's true. I mean, look, just about every medicine that comes to market, there's some unmet need. And you could argue that some medicines may be, quote, more impactful than others. But the truth is, if you have that disease or you have that condition, no matter how mild it might appear to somebody else, if it's bad enough that you are willing to take a therapy to treat it, it's significant, right?
Yep. Yep.
So all of us in the industry are doing something to help, and I think it's hard to really stack one against the other. You know, you can have people who have things that are far from life threatening, but are super super impactful in their life. Let's use infertility as an example, right?
Oh yeah.
You take families who are unable to conceive, they're unable to have children, and here they are, they have therapies that are available that help them be able to have new life in their family, right? And then you have things that are seemingly not as impactful. You said before about foot fungus. Well, that seems very trite until you have it and you're
Yep.
walking around with your feet itching every day.
Yep.
So at the end of the day, our goal is to improve or lengthen the quality of people's lives, and
Yep.
to me, that's this is all about. It's cool, man. And people joke, in medicine, like, "Hey, you went to the dark side," and yeah, it's a joke, and I guess to some extent, if you want to call it, that's true. But I don't see it as the dark side. I see it as a different way that I can use different tools to go about helping people.
Absolutely. Absolutely. Well, listen, this was a lot of fun. I can't believe where we went through as much in depth with this. We're almost at 40 minutes. I mean, this was a lot of fun. But I'll tell you, I'm super excited about the next time, trying to sit down and pull a little bit about you and what brought you into industry. Even though I know a little bit of it was me, so I'm excited to hear about it.
Yep, absolutely. No, I look forward to that too. But Scott, this has been great. I enjoyed it. I learned new things about your background today too. And again, I just want to come back to where we started. I've been really excited about this project that we've been pulling together. This was your brainchild in the beginning, and I'm really happy that you brought it my way. It's been exciting, so thank you for that. And on a personal note, I'm really glad you're doing well and healed up and back in action, and life is good for you. So thank you for everything.
Oh, it's been so much fun. For everybody listening or watching, please go to our website, thebiotechproject.com. Subscribe to our mailing list. We're going to be kicking that off soon. Definitely go to the podcast and subscribe to the podcast. Like our LinkedIn page, like our website. Share your thoughts. If you've got some, share them with us. We can't grow and get better without knowing not just the good, but also some of the things that you'd like to see. If you have an idea for a guest, if you have an idea for a topic for us to discuss, please let us know. We really want this to be valued to you. But check us out on YouTube at YouTube. We are the Biotech Project. On Twitter, we're the Biotech Proj, Proj. On LinkedIn, the Biotech Project. Facebook, the Biotech Project. And the website, once again, is www.thebiotechproject.com. I am Scott, one half of your co-hosting duo, and it was great to talk to you all today. John, thanks again for giving me the opportunity to talk today to you.
No, my pleasure. It's always fun, Scott. Look forward to the next one. Have a good one.
Take care, everyone.
You've been listening to the Biotech Project. Scott and John have 50 years of combined expertise, with roles that have covered everything from frontline sales to senior vice president of medical affairs. Scott and John are industry veterans, equipping you with knowledge from guests in every role from CEO to sales, recruiters to hiring managers. We hope you've enjoyed the show, and we hope you've gotten some useful and practical information. We'll be back soon, but in the meantime, check out the website at www.thebiotechproject.com. And for questions and comments, send an email to hosts@thebiotechproject.com. See you next time.